Hello, my name is Nurse Engee, and today's topic is osteoarthritis. What is osteoarthritis? Osteoarthritis, or OA, is the progressive degeneration of articular cartilage and formation of new bone spurs. OA has no inflammation and is localized without systemic effects. OA primarily affects specific joints. Osteoarthritis typically involves weight-bearing joints such as the hips and knees. It also generally involves overuse small joints of the hands. Activities like kneading can cause osteoarthritis. Osteoarthritis is caused by the overuse of joints and the breaking down of the cartilages and the tissues in the joint. So it only makes sense that repetitive use throughout the day is going to cause more pain and more symptoms. Because bones are rubbing on one another, clients have crepitus with movement, and this can sometimes even be heard audibly. Crepitus is an audible crackling sound that occurs when joints rub together, and clients may feel a grating sensation in affected joints. The body forms bone spurs and enlarges the joint with the nodes to try to compensate for the lost tissues. You can see this in the images to the right. Remember that osteoarthritis is going to primarily affect weight-bearing joints. So clients may have a modified gait or a limp to avoid putting pain on these weight-bearing joints. What are the risk factors for osteoarthritis? The risk factors for osteoarthritis include 1. Obesity. Obesity is because excess body weight puts extra pressure on the weight-bearing joints. Prior joint injuries are also contributing factors, such as ACL tear in the knees is also a risk factor for OA. With injuries like this, the joints can become misaligned and placing inappropriate pressure in different places of the joints. Finally, advanced age is a great risk factor for osteoarthritis. Over time, cartilages begins to break down and can even wear away in the body. This can lead to bone-on-bone friction and cause a lot of pain and OA. As shown in the images to our left, broken or missing cartilages result in a narrow joint space. In this narrow joint space, exposed bones can rub on one another. Bone spurs also form as the body attempts to compensate for missing cushion by creating its own. Let's compare osteoarthritis and contrast it as well with rheumatoid arthritis or RA. Rheumatoid arthritis or RA is another form of arthritis but has many differences with osteoarthritis. Some of them are as follows. Rheumatoid arthritis has inflammation and is localized with systemic effects. Unlike in RA, osteoarthritis has no inflammation and is localized without systemic effects. Rheumatoid arthritis is going to affect the whole body, whereas OA is just going to affect specific joints. OA is characterized by joint pain and stiffness, and this gets worse as the day progresses, but improves with rest. When we contrast this with rheumatoid arthritis, we see that RA gets better as the day progresses, but is worsened with rest. In osteoarthritis, there's typically little to no swelling. Swelling really going to only occur when there's some sort of injury or there's a drastic overuse to the site. We contrast this with RA and we see that in RA, there's swelling all the time and often in multiple places in the body. What are the clinical features of osteoarthritis? Osteoarthritis is diagnosed with X-ray. In X-ray, you can see the bone enlargement and the nodes. And if the loss of cartilage is bad enough, sometimes on X-ray, you can even see the bones touching one another. Finally, it is important to know that osteoarthritis, we are not going to have the same changes in laboratory values that we have with RA. In OA, there will be no rheumatoid factor present in the blood, and the ESR, or the erythrocyte sedimentation rate, is relatively unchanged. Remember, ESR, or erythrocyte sedimentation rate, tells us that there is inflammation in the body. OA doesn't have much inflammation, so it's not going to cause our ESR to increase. So we're going to go to the nursing interventions. What are the nursing interventions? With osteoarthritis, management of acute swelling and pain is very important. Non-steroid anti-inflammatory drugs, NSAIDs, are going to help decrease inflammation, as will rest and cold therapies such as ice baths. If clients have done something to cause swelling in the joint, we need to wait till it subsides, and then we can apply moist heat. Moist heat will increase circulation to the area. Ideally, we want to prevent or reduce the number of acute pain episodes these clients are having. So long-term management is very important for clients with osteoarthritis. Assistive devices like a cane and walker can help offload pressure from the weight-bearing joints, like the knees and the hips, onto the device. Clients can wear splints or braces in affected joints to help immobilize them and reduce use of them. Raised chairs and elevated toilet seats can be used at home. When you think about going to the bathroom or even sitting in a chair, clients have to bend down a lot. And even when they stand up, this is going to put a lot of pressure on the hips and the knees. If we can reduce the amount clients are having to bend and having to move, we can lessen their symptoms. Clients should be encouraged to complete regular muscle strengthening exercises. If we can strengthen the muscles, we can take the load off the joints a bit and put it onto the muscles, which will reduce pain and reduce the worsening of osteoarthritis. Finally, if clients are obese, weight loss should be encouraged. Removing excess weight on the body is going to decrease the stress and pressure put on the weight-bearing joint and reduce the client's symptoms. That marks the end of our today's topic, osteoarthritis. See you next time. Bye.